During the testing, if you taste it in the mask, it'll be a fresh dose and it'll be stronger. So you won't really have to question whether or not it works. Yeah, I'm sorry. Saccharin's so much kinder, but yeah.
Clearly, we're the first region to experience this level of disease. Most of the deaths in the United States are still from Washington State and from King County. And we know that we're out in front of this. We're getting support from the state, we're getting support from the CDC, but we know that there's going to be a limit to that support.
And then using 2 hands, mold that metal. Go ahead and move your bottom strap all the way down. Yeah. Make sure you have a very tight seal on your nose.
We need to protect our staff. If they get sick and they're out for 2 weeks, we cannot replace that resource. So the uncertainty keeps me up at night.
All right, so now you guys are gonna move around for a minute. You can hang on to your hoods while you do this. You kind of want to bend up and down, emulate patient care activities. You just want to move around. It can be
somewhere around 15% of the people that test positive for this infection are going to have pretty severe disease, and that somewhere around 3 to 5% of folks are going to end up being critically ill. We can't change those numbers. That's intrinsic to the virus.
All right, so you can remove your hoods.
So, knowing what we're going to be facing, which is an influx of patients with severe respiratory illness, and some of whom are going to need critical care and maybe ventilatory support, knowing that that's coming, and that's going to be a huge surge. We're a hospital system and a region that works near full capacity all the time. So we need to say, what can we do to expand our capacity to take on these extra patients as they come on? What we're doing right now is taking our surgical unit and converting it to a COVID unit by turning all of the rooms into negative pressure rooms, and in a way that we can turn the entire unit into a negative pressure unit, should that be required. But yet now it's critical that people understand that the ethics of providing healthcare change in a pandemic, or may change in a pandemic. People's elective procedures are being canceled, and they may not be able to get in to see their physician, and they may not even be able to do a simple procedure because we need the personal protective equipment for people in the ICU. The hope is that the combination of increasing our surge capacity and a curve that's flatter than it is in Italy means that we never get to a point where we have to move from basic standard of care, usual standard of care practice, to what is called crisis standard of care. So crisis standards of care is defined essentially as a place in a healthcare system where you lack one or more crucial resource. And those resources could be your staff, things like personal protective equipment or ventilators. If you get to that point, if there simply are not enough resources to care for people in a way that meets basic standard of care, then what you want to do is make sure that you're allocating what resources you do have in a fair and equitable way. If we do get to a point where we're in crisis standards of care, we will be allocating resources more and more toward younger people, not necessarily because they're younger, but because younger people are likely to do better with this disease.
Okay, so I'm going to have you look straight ahead. You're going to tilt your head back, and then I'm going to go in. I have to do both nares.
It's up to the public to slow the rate of infection as much as they can. One infected person, it looks like, tends to spread this infection to 2.5 people. If we can lower that even a bit, that may give us the breathing room on the healthcare system side so that we can handle this crush.
We're stacking.
So I think the idea of social distancing is really an idea of physical distancing. The idea that, try not to expose yourself, at least in close quarters, to a large number of people, particularly if you don't know them and you don't know their health status. It's crucial, it is absolutely crucial to bending that curve, to trying to prevent the rate of climb of infection that may very well overwhelm our system. Just don't wait till things start to be a problem, because that's probably too late.